It's mobility time, and guess what? These two movements are things that I know you've done before, but you're probably neglecting them because you don't want to do them, but we should. And we're going to be talking about the quads and hip flexors. Oftentimes when these get super sticky and tight, the low back starts hurting. So when you have back pain, check out those hip flexors, and I'll tell you why in a second. First one, very easy, foam rolling the quads. Again, we hate it, but you know what? Got to do some things that you hate every once in a while. So the way I like to do this is I like to put the foam roller on the ground, and then we're going to start mobilizing the right quads. Get on the foam roller and scan just a little bit. Find that nasty spot, and once you find it, keep that pressure there, and then bend up and down. So what we're trying to do is we're trying to get those muscles to move between the bone, the femur, and the foam roller, and it should be a little uncomfortable. Now, here's a quick tip. I'll show you on the other side. My quads are extremely irritable sometimes, so I don't like just putting all my weight on it. What I do, my little cheat, is that I put this foot up and help support it. That means that if it's too tender for me, I roll over, put more pressure on this side until it desensitizes, and then I can start moving over, putting all my weight on it, finding those spots, and then going through that knee flexion, knee extension movement. So why does the back hurt when the hip flexors are tight? Well, what happens is that the muscles go from here all the way to the spine. So if this doesn't want to straighten out because everything's pulling here, what we do is we overarch the back. And as you can imagine, running, weightlifting, jumping, landing in an extended back position really isn't favorable to the structures back there. We want to make sure that these can open up. So when we get into this tall kneeling position or standing, we can drive the hip forward instead of arching the back. Now, how do you do that? Great question. I'm glad you asked, because right after we do the foam rolling, all of this should be nice and loose, nice and open. So we're going to go straight into a couch stretch. Now, the couch stretch is a very simple exercise that can be done poorly. Half kneeling position, and you're going to get your foot up on a bench, a box, or perhaps a couch. Foot's going to go up, knee's going to be on the ground, and you're going to go up nice and tall. Now, like we said before, we don't want to overarch. We don't want to lean forward. What we're trying to do is we're trying to mobilize that hip joint to take some pressure off of the back. So driving the hip forward, getting that glute extension is going to be where you want to go. So the way I like to think about it is kneel nice and tall. Pretend you're a creepy neighbor looking over the fence, seeing what they're barbecuing. Is it hamburgers? Is it sausages? I don't know. Fish, weird. You should feel that nice big stretch in the front and just hold that there. Now, if you're having a little difficulty pushing forward, or if you just want a little bit more intense, what I suggest is using a band. So attach it to something nice and stable. I have a kettlebell here. You can attach it to your bedpost, to your table, to a rack. It doesn't really matter. We just want something to pull forward. So the band goes around like this, kneel up nice and tall, and it should be some really good tension, and that band should be pulling you forward. You're going to feel a little bit different of a stretch on the front, probably a little bit more intense, so maybe don't start with this one. Now, time domains for each of these. For the foam rolling, 30-second bouts. For the quad stretch, 30, 45, 60-second bouts. Switch sides. What I want to do is I want to do the foam rolling first to calm the muscles down, let everything move a little bit better, and then explore that new range of motion with this couch stretch. So 2 movements. Should take you 5, maybe 10 minutes if you really want to dig into it. The goal, guys, is can we help you become confident that your body is going to support your active lifestyle? Because we want you to go do cool stuff. Can't do that with a broken body.